Good morning, everybody. Just who in this hall is dealing with antimicrobial resistance or stewardship as part of their research and education? So a couple of people. Okay, so I'm taking this from, so we had lovely presentations from the private health sector. Now you're going to see what's happening in the public health sector. I'm going to give a background to antimicrobial resistance in South Africa from the national level. So why do we need a strategy and plan? So we already understand that antimicrobial resistance from the previous presentations is quite an issue. So in the plan going forward, we're not really taking a look at the multi-drug resistant TB and the drug-resistant HIV, although these are heavy burdens in South Africa. These programs have received a lot of funding and research in past years. So we need to, sorry, there's something here. So we need to put a lot of our focus now onto that third block at the bottom, our bacteria and fungi. They're beginning to overtake us. So the 6 main causes of antimicrobial resistance is one of the ones that we all know about, being pharmacists, is the overprescribing of antibiotics. So somebody will come in with a flu, we'll give them antibiotics and send them on their way. Patients also don't finish their treatment. If they're anything like pharmacists, they probably take it until they feel better and then discard the rest of the tablets. Of interest is the overuse of antibiotics in livestock and fish farming. So who in this hall has thought about antibiotic use in animals before? Okay. Poor infection control in hospitals and clinics. I'm sure everyone's seen quite a few of the private groups having hand washing campaigns and so on. There's also lack of hygiene and poor sanitation. Fortunately, we have clean running water, so we can be happy about that. There's also a lack of new antibiotics being developed. So I'm sure most people in this hall are aware that the pipeline of antibiotics is a bit empty at the moment. So what is One Health? So we need to look at the One Health approach. So I briefly mentioned the animals. So previously we used to take healthcare as the human healthcare would be on the side, the vets would look after the animals on that side, and somebody in the environment would look after the environment on the other side. And then we come to realize it's all integrated. It's a One Health approach. So what is happening in humans is going to affect the animals, which is going to affect humans, which is going to affect the environment. I'm sure people have been hearing about the colistin, the resistant colistin from pigs that you can pick up off the shelf, ingest, and have colistin resistant bugs yourself. So what is the cycle of One Health? It's very similar in the animal health and also in the human health. So we have those antibiotics, we give them to our animals, the animals become resistant to it in the gut flora. We either get the resistance from contact with the animals or from ingesting the animal products, such as our colistin pigs. It's the same as in humans. We give our patients antibiotics, maybe irrationally, then they eventually end up in hospital with resistant bugs, and they touch other people or they spread their bugs to other people. And at the end of the day, you, myself, and our families are colonized with resistant organisms. So what is the cycle that we took in South Africa? Okay, so Shirley Ann mentioned earlier about the GARP in 2011. So they did a situational analysis and published it in the South African Medical Journal, and we kind of realized we're having a problem. There's a serious problem going on. We need to start looking into this and do something about it. So in 2012, the development of the South African Antimicrobial Stewardship Partnership was developed, the SARS Committee. I'm sure a lot of people have heard about it. There's even an app for this society. In October 2013, the Antimicrobial Resistance Working Group was established, and stakeholder and consultative meetings were starting to be held. Then at the same time, the World Health Association had a resolution about combating AMR, including antibiotic resistance. So this is from the World Health Organization, and I'll show you a little bit more just now. In October, the DG held a summit to launch the antimicrobial resistance strategic framework. In June 2015, as Shirley Ann showed in her presentations as well, the Department of Health published the South African Implementation Plan. In 2016, there's been a lot of interaction between the veterinary side or the animal health side and the human health with regards to developing our strategy. And in 2016, we're starting to bring in the provinces and roll the implementation out to the provinces. So this is what happened. So the Global Action Plan was developed by the World Health Organization, and they said that by May 2017, all countries have to develop a national action plan to deal with antimicrobial resistance. South Africa jumped onto the board immediately, and in 2014 we had a national strategic framework, and we also assisting other African countries to develop theirs at the moment as well. Then the end of last year, we developed the implementation plan. So the implementation plan is, we have a strategy framework. Now, how do we actually achieve those outcomes? The implementation plan is how to achieve those outcomes. So this is the situational analysis that GARP did. And there's also other supporting studies that showed that pretty much this is definitely what's happening. Now, this is the launch that happened in October 2014. You can see our DG, is there a pointer? So here's our DG. Here's Prof. Mark Mendelsohn. So there's quite a few stakeholders, and this is the document that everyone signed. So all these stakeholders came together, and they signed their commitment for collaboration and also to invest resources to implement strategies. So we've heard that these things take time and money, things that a lot of people don't have. So we need this commitment from everybody to say that they will allocate time and money for these interventions. And this is what it looks like. So if you can take a look here. So here's, okay, it's not working so great. Okay, sorry about this. Don't know what to press here. Right at the top. Okay, great. So here's government. So we're endorsing the process happening in South Africa. There's laboratory, so private and public laboratories. Clinical societies, there's the SASP. Civil societies, so there's Section 27 to antagonize on our behalf. And regulatory societies, so there's the Pharmacy Council, for example. So now, what does a strategy look like? So it looks like a house. Okay, so here's our strategic objectives. We're looking into diagnostic stewardship, enhancing the surveillance of the organisms, antimicrobial stewardship, which a lot of people are talking about, and prevention, so infection prevention, control, and vaccination. And underlying this or supporting this are the enablers, the health system strengthening, research and education, where I believe everyone in this room is coming into this, and communication strategies. And then, what is the point of this house? So we want to have an impact on the rational use of antimicrobials, because all of us are here coming together to improve patient outcomes. So this is just going a little bit deeper into the house. So here's the strategic objectives and the enablers. So the enablers are supporting the objectives. And here we have education. So we need education at all levels of health. I don't know if anyone was following the tweet chat last night about integrating health and education, but some people were saying from preschool, teaching children to wash hands and to just ingrain that in them as they grow up. Antimicrobial stewardship is there, infection control, and then research. So we don't only need new antimicrobials in the pipeline. We need novel diagnostics at the point of care, increasing turnaround times. We also need clinical trials on the treatments that we have at the moment, treatment durations and so on and so forth. Okay. As was mentioned by the private health sector as well, it's all good and well saying you're going to do something, but how are you going to know if it's actually going to have an impact? So you have to have a monitoring and evaluation plan in place. So it's pretty short on this slide, but basically we also have a group of key organisms that we'll be monitoring. And then to see if these objectives are being met, we're going to see a reduction in these organisms, hopefully. We're also going to see a reduction in the consumption of antimicrobials that match these organisms we're looking at. And then we want to see reductions in maternal and neonatal mortality as well. Okay, so 2016, what have we been up to? So recently we've been looking, whoa, it came out really badly. sorry, you can't see this very nicely. I'll just read them out to you. So there's a ministerial appointed committee on antimicrobial resistance. So these are all the stakeholders. Sorry, you can't read them. So here, even though they're not so strong on this committee, we have HIV and TB representation. So lessons learned from these programs, hopefully we can pull them into the AMR program. There's veterinarians, healthcare workers, regulatory, other departments such as trade and industry, agriculture, fisheries and forestries, all the laboratories included in here. So what is the role of the MAC? So we want somebody to institutionalize effective systems. This is for private, public, animal, and human health, so the One Health approach I mentioned earlier. We also need to structure national surveillance. So currently we have a bunch of silos where public is publishing here, private is publishing there. So we can see snapshots of what's happening in different areas. So we just need to structure this so that we can see from a national level what is happening. And also from animal and human sides as well. And also to assist in selection of antimicrobial agents that will go into the essential medicines list and standard treatment guidelines. Based on these patterns of resistance we're hoping to see. Okay, they're going to assist in developing with the provincial antimicrobial resistance plans. The provinces most of them are pretty new and needing lots of help and assistance. We currently updating the AMR strategy because we're keen to strengthen this One Health approach. We're also currently doing the antimicrobial stewardship guidelines for human and animal health. And I'm not sure if anyone was aware of the World Antibiotic Awareness Week last year. It's in November, was in November 2015. Was nobody aware of it? Okay. So watch the space, November 2016. There's quite a lot of huge things planned. So that's the World Antibiotic Awareness Week, but it's also the National Antibiotics Awareness Week, and it's on our health calendar as well. Thank you very much.